The mouth is the window to our body, but how well do you know what is actually happening in our mouth? What is the cost of sustaining your natural teeth? And what is the safety of dental makeovers out there? This is our focus today on sound health. Good evening. Welcome to the show. I am Olasumbo Mudupe. Sound health continues in a moment. Please stay tuned. The program is still Sound Health on Lagos Television. Join us via Zoom to share more expertise on dental care as well as aesthetics and the cost of taking up any of all these makeover we see out there is Dr. Olamilekan Gafar. He is a dental surgeon and he's going to tell us all we need to know about dental care and aesthetics. Good evening, Dr. Gafar, and thanks for joining us.
Good evening. Thank you for having me. My name is Dr. Gafar.
Okay, yeah, thank you for finding time to join us on the show. Okay, so Dr. Gafar, in this part of the world, we hardly visit the dentist. We do not see that need to see a dentist until we keep experiencing pain, severe pain. What is the normal routine for a dental care?
Okay, so as you said earlier, that this part of the world we find it very hard to visit the dentist. In short, we say that dental care is underrated, and then I think one of the major reason is as a result that just because before most people present to dental clinic only when there is pain, and then before there can be pain, it's going to take a very longer period of time. That is one of the reason because it is not like something of urgence to them. And then due to the economic situation of the country, they'll be like, have I fed enough to be able to now go and see the dentist? And then they don't know that just as hypertension takes time before people know about it, it's just as similar as dental care as well. Most people don't present early enough because there is no pain. And then before there can be pain, it's going to take a longer period of time. And then that's why most people only present to dental clinic when there is pain alone.
Usually the mouth is the window to our heart and body. What is the routine care coming from a dental surgeon now? The routine care
Okay.
the public should take up.
Yeah, thank you very much. So one of those things that you said is that mouth is the gateway to the body. Like there are a lot of things that happen in the mouth that even mere perceiving your breath alone, I could tell you if someone have a kidney problem or a liver problem. And then also with a very poor oral hygiene, some people it can lead to some condition like infective endocarditis. People with periodontitis can have low birth weight, low sperm count. Some people can even have preterm labor, and so on and so forth. So, and then the basic things you need to do is just to brush 2 times daily, morning and last thing you do before going to bed. Brushing in the morning, some literature said that you brush very early in the morning. Some says after eating in the morning. If you are to brush after eating in the morning, it should be at least 30 minutes to 1 hour after. Then another thing you need to do is you need to brush with fluoridated toothpaste. Just check the brown. If there is fluoride on it, you are good to go. And another thing is that you should floss. That's remove the dirt in between your teeth. Visit your dentist minimum of twice in a year. And then also you need to do scaling and polishing, which is a dental cleaning whereby the stain or food particle or some other substance in your teeth that your normal toothbrushing cannot remove. So the dentist help you clean it by a process called scaling and polishing. And another thing is that you can use dental floss to clean in between your teeth. We have what is known as interdental toothbrushes. All these basic things alone can prevent, and I can tell you that most dental condition, aside from trauma or accident, is almost 100% preventable if early noticed and presented.
Okay,
Thank you.
sincerely, many of us are guilty of this dental care routine. We do not abide or adhere strictly to all this dental care. Fine, most of us brush our teeth in the morning, but in the evening, I can say if you put about 10 people out there, maybe four maybe just 4 people would brush at night. Okay, we are taking notes. We are taking notes from you. Okay, Dr. Gafar, let's debunk some myths about dental care out there. We, because of the digital age, we experience so many wellness noise on the social media. You read some things on the social media and you wonder, okay, is this person is certified doctor? Some people take up home remedies, some do it yourself tips out there. One of them is using charcoal and another one is using salt. Coming from a certified medical dental surgeon now, is this acceptable?
Okay, so fine. So let's speak it this way. I think there needs to be a regulation that not every advice you see on social media is a professional advice. So I would advise that most professionals should also go into that social media and give first and professional advice to the populace. So not every advice you get on social media is actually the truth. So that's number one. So also talking about all these natural remedies like salt, lime, charcoal, and everything. Being natural does not make it safe. Being natural does not make it safe. So charcoal, salt, and lime. Some said it helps with teeth whitening. Maybe it will probably give a transient, more like a temporary whitening. But at the long run, because of the abrasive of charcoal, lime, and everything, like lime is acidic, so you can even wear off your dental enamel, which is that white part of your teeth you're seeing. And then the beautiful thing is that once that thing wears off, it cannot regenerate itself again. So it will prone you to all sorts of sensitivities and the likes like that. So do it yourself at home. I believe that most dental care should be sought by dental professionals. They're not things you can just do on your own the because when you say you want to do it at home, you're trying to save cost. At the end of the time, by the time the problem results, the money you're supposed to spend with the dentist doing it for you initially will be more than what you have to do after you've done it at home yourself, and you're now down with all sorts of complications afterwards. So if you take care of your oral health, there is something we call early lesion, incipient lesion. Just as the way people do breast examination for breast cancer, if you wake up in the morning and you look into the mirror, there is something you would see, which, if you are beginning to have dental care, is called white lesion. That thing will be like, there'll be a kind of a point on your teeth, which is whiter than the rest it will be whiter than the other part of the teeth. With just your toothpaste in the house alone and some other things that dentists can give you, it can prevent it from having hole in your teeth. And depending on the extent of the hole, like if you are going to fill alone, the cost is still a bit affordable. Having to go through root canal, after root canal, you have to do crowning, which is more expensive. So if you present early enough to your dental clinic at least twice in a year, most of this will be preventable. And another thing is that there are other insurance HMO out there which help subsidize dental services as well. Yeah.
All right, so you
Thank you.
mentioned crowning, you mentioned some other terminologies out in your response. Let us look at all this. They are all under aesthetics. You see people say, I'm going for whitening. You see people say, I'm
Okay.
going for crowning, braces, stoning, glitters, just for fashion. Where did you draw the line from fashion or to care, to self care? And how far can you go to achieve this?
So dental aesthetics generally should enhance your health, not compromise it. So for seeking all these dental, well, let me put a differences. There's a differences between a dental aesthetics and cosmetics, but it goes hand in hand. So for everybody that wants to pick up any form of dental cosmetics, I would advise that it is best done with the dental professionals. For example, when you talk about teeth whitening, not everybody is a candidate for teeth whitening, and then not everybody is indicated for it. But when you present to your dentist, you will be able to tell you that, oh, okay, you can go for teeth whitening. Oh, if you don't do teeth whitening, why don't you do this other treatment? Or why not you try veneer or some other treatment that can help improve the shade of your teeth. Though people seek cosmetic dentistry for several reasons due to all the social media. Some people just for personal preferences. They want to have a brighter smile, which is fine. Some people they want to have this Hollywood smile, like their celebrity smile and everything like that, which is fine. But it is best to take it from a dentist. So talking about whitening, not everybody is a candidate for whitening. Talking about crowning, most especially among Muslims, crowning LD tooth, it is not advisable. We often crown teeth based on several reasons. One of it is that after a root canal treatment, because the teeth is no longer alive again, we crown it in order to reinforce the tooth. So crowning teeth for Muslims that go to Hajj for aesthetics purpose, it is highly discouraged to be done. And another thing is that talking about braces and aligner. So these are orthodontics treatment that helps to straighten the teeth. But now there is now a fashion trend now that people use fashion braces. Thank God. Let them keep using fashion braces. They will come back and use that normal therapeutic braces at the long run, and it's very expensive. Let them keep doing it. But I would advise you stop using fashion braces. You only use braces when you need to do it, and your orthodontics is going to tell you which of it you have to use. And also talking about tooth jam, yeah, people have different things about tooth jam, but me, I would say that anything you want to do, it is best you do it with your dental professionals. So you filing your teeth, creating gap in between your teeth, having a crown on LD tooth, doing all this do it yourself at home, all this tooth jam and everything like that, or using unregulated teeth whitening kit. All these things can lead to a serious complication if not properly done by a dental professionals.
Okay,
Yes.
of all the fashion aesthetics you mentioned now, I picked up gap tooth. Many people go to Underbridge, Ikeja, close to us here, to get gap tooth.
Yes.
Is this acceptable? And some, like me, I have this natural gap tooth. I've also heard somebody told me that the gap tooth is not healthy. Is this true?
Uh,
Mine
Okay,
is
so
natural.
now
Mine
let me
is
pick it
natural.
from
Mine is
gap
natural,
teeth,
Dr.
not
Gafar.
LD. So the thing is, okay, so can you hear me?
Yes, mine is my own gap tooth is natural. I didn't go to
Yes.
Ikeja under bridge to
So now,
space
you know,
up.
I said something is that the fact that something is natural does not mean it is ideal. Do you understand? Some people are
Okay.
born with congenital defects. Does it make it normal? No. So as an orthodontics, having a gap tooth is not should I call it abnormal, or yeah, you're supposed not to have space in between your teeth. So you can
Okay.
close it with an orthodontics treatment. That is
Oh.
it. So now going back to those people in Underbridge, I have seen it before, people doing it. Number one thing is that people that have it naturally, we are even trying to close it. Now you are filing your teeth in order to have gap teeth. Number one is that one of the problem is that as you are reducing that enamel, which is that white part of your teeth, you are exposing your teeth to more sensitivity. Another thing is that most of those things are not properly sterilized, because I have seen where they are doing it. That person just said, "I want to do gap teeth. Mumba, mumba, mumba. I'm coming. Let me get it done for you." And that guy just brought out that file. That's something from somewhere, and I was shaping the woman's teeth.
Hey.
After doing that person's own, there was blood coming out, and immediately he transferred it to use for another patient. That is even what's it called? Cross infection, like passing infection. If that person is infected with any blood disease, you can easily move it from one person to another. So I think such practice should be discouraged. And then if there is anything Lagos State government can do about it, those people should be arrested and prosecuted for doing such. Thank you.
All right. So let's quickly clear some myth out there. Some would tell you braces is better than Invisalign. Can you please clear that?
Okay, so both braces and Invisalign, they are the same. They are fine. None is actually superior to another. Anybody can have it. So let me just give about three differences or why. So number one is that the same. Most times, braces is the conventional, the traditional olden days of aligning teeth, which we still use now. But due to the event of technologies and everything, make it easier. That is That's when we have aligners or Invisalign, as you mentioned. So braces, basically, you can use it to correct severe malocclusion. That is when there is malalignment in the teeth, and then also it's a bit it's faster. It's faster, and then another thing is that it is quite affordable when compared to aligners or
Okay.
Invisalign. And another good thing about braces is that you really don't need yeah, there are sometimes that you really don't need the only you need patient cooperation in order to clean it, because if not properly clean, it can lead to some other conditions like gingivitis and the likes like that. But the thing is just that because the dentist is the one fixing it, it helps the treatment faster. The patient cannot easily remove it, or do you understand? But as compared to aligners or Invisalign, as you mentioned, is that it's a bit faster. It's faster as compared to braces. And another thing is that it is way expensive. And another thing is aligner is a bit aesthetically pleasing, because when you wear it, you just wear it. People might not really know that you are wearing anything in your mouth. And another good thing about it is that, unlike braces, if you are eating, there's some food you might not be able to eat. But with your aligners, you can just remove it, eat your food, brush, and wear it back. Do you understand? But then when using it, one of the things is that when using an aligner, patient cooperation is highly needed, because there's a particular period of time during the day you have to wear it. So if the patient do not wear it, there will not be changes as compared to braces that you put it there. It's only me that can remove it. Do you understand? So both of them have their advantages. So we just have to come to the dentist, will evaluate you and see which one, and then as compared to your pocket,
All right.
yes, and how
Teeth.
fast you want your
All
treatment.
right. Teeth whitening and scale and polishing. Which would you advise?
Okay, so okay, teeth whitening is not for everybody. It's just to improve the shade of your teeth. Why scaling and polishing? It is a must for everybody. Scaling and polishing is therapeutic. Even there are sometimes that if you are going for some art surgery, you have to do scaling and polishing before you can go for that surgery. So what I'm saying in essence is that scaling, and it's supposed to be done twice every year, every six months, which coincide with your dental visit. So if you're just going for just your normal routine dental checkup, you just do it. So for now, this is the best time you can do it. If you've not done it, just do it in January, and the next time you'll be doing it is in July. Do you understand? So scaling and polishing is for everybody. White teeth whitening is not for everybody.
All
Teeth
right.
whitening helps to improve the shade of your teeth, while scaling and polishing, though at times when you do scaling and polishing at times, it also help with the shade of your teeth because of all those whitish tactile you see on the teeth surface, or probably from stain from coffee or eating cola nut and stuff like that. You get, it
All right.
also help, but scaling and polishing is therapeutic and is for everybody.
All right.
White teeth whitening is to improve the shade of the teeth and is not for everybody.
All right. Does scaling and polishing helps with
Yeah.
mouth odor? Does it reduces?
Definitely.
All right.
Yes, definitely. Some of those, yes, some of those food deposits or some other deposits in our mouth that your normal toothbrushing cannot remove, with time, bacterial effect and some other thing would can also lead to bad breath. Yes. So so one of the treatments is that once the patient comes with bad breath, there are a lot of things that causes bad breath. Okay, so there are a lot of things we check. Then also some that it can be as a result of those deaths. I don't want to call it, we call it a calculus or tata for people to understand. So with your scaling and polishing, it often also help with bad breath, but it is not the total solution to bad breath because there are several causes of bad breath.
All right.
Yeah, thank you.
The makeover. When is it recommended, and are there side effects?
Aesthetic, for dental aesthetics now, it's something you have to be doing every day. Dental aesthetic is keeping your teeth healthy. Do you understand? That's just the general time. So you have to be brushing two times daily, morning and last thing before going to bed, using fluoridated toothpaste, flossing in between your teeth, regular dental checkup, even checking your teeth yourself in the house as well. Do you understand? Why cosmetics depends on individual. If you felt, oh, you want a brighter smile, then go for it, but do it with a certified dentist or a dental professionals. Do you understand? And then also talking about you said about side effects. I would say it, every dental procedure has a potential side effect, but then when done properly, can minimize the side effects, and it's often temporary. For example, when patients go for teeth whitening, one of the things that people often see from teeth whitening is sensitivity, which is always temporal. But if you're doing it with the dentist, number one, I will evaluate you to see that don't you have a sensitive teeth before. Number two is that even after the procedures, I can give you like desensitizer to help with sensitivity. There are a lot of things we can do as compared to when you go to all those beauty parlor. All what those ones need is they just want your money. And I've seen some patient coming to the clinic that the lady cannot even talk. She has to cover her mouth because of the sensitivity she felt after doing the teeth whitening from a beauty parlor. So for everything, for any aesthetics procedures you want to seek, please seek from a dental professionals.
All right. Your final words as we wrap
Thank
up
you.
now, Dr. Gafar.
Okay, so my final word is that the risk of neglecting your oral health is far greater than the risk of proper treatment. So I would advise that we should try as much as possible visit our dentist every 6 months. Not all the time you go, you have to do sophisticated procedures. As people would say, there's a general saying that prevention is better than cure. And then I am telling you, as a dental surgeon, certified one in Nigeria, that most dental conditions are 100% preventable. Just doing your normal basic routine as I had explained earlier, and visit your dentist. And then with that, gonna have that brighter smile.
Most dental procedure people go for are actually preventable if you practiced prevention or the normal dental routine care recommended by doctors, recommended by dentists. Dr. Gafar Olamilekan, thank you so much for your time and expertise on the show. We really appreciate you.
Thank you very much. I am glad to have shared from my little word of knowledge, and I hope the general populace take into it. Dental care is not expensive when you present early enough.
All right, dental
Thank you very
care
much.
is not expensive when you present early enough. Sound Health continues with trending health report from around the world. Please stay tuned. Welcome back. The program has been Sound Health on Lagos Television. Whether you are looking for confidence or you're trying to boost your confidence or ensure you sustain your natural teeth, ensure you see a certified dentist to prevent any unnecessary dental procedures. This is where we say thank you on today's episode of Sound Health. For comments and inquiries, or you have topics you'd like us to treat, please send SMS to 0035826603 or follow us on social media at Lagos Television, #Sound Health. A sound health is a sound mind. Make healthy living your choice.